Hello, ladies and gentlemen. My name is Dr. Paul Goldfinger. I'm a cardiologist, a heart specialist, board certified. I went to medical school at the George Washington University in Washington, D.C., and I did my postgraduate training at the Mount Sinai Hospital and Medical School in New York City. I have practiced cardiology for about 30 years, and about 20 years ago, I developed an interest in preventive cardiology. It's a new specialty. And I became interested because about 20 years ago, the first scientific evidence emerged that it was really possible to prevent heart disease. And I suspect maybe some of you don't know that it is possible to prevent heart disease. The heart disease that I'm talking about is called coronary artery disease. These blood vessels on the surface of the heart are the coronary arteries. And if they become obstructed, then you can have problems such as a heart attack or chest pains. I'm going to need that there. The cause of the narrowing that occurs in coronary artery disease is a buildup of fat and plaque within the blood vessel called atherosclerosis. Thank you, my assistant. This is a model of a coronary artery, and you can see these yellow plaque buildups of fat and cholesterol that begin to encroach upon the opening. And if you look down the cross-section of it, you can see that this particular model is partially obstructed by about 50% by this plaque, this atherosclerotic plaque. One thing you should know when it comes to prevention, that this is a process that takes a long time to develop, but it actually starts in childhood. So when you think about preventing heart disease, you've got to think about what you're going to do for children also to get them on the right track to keep their arteries from becoming clogged. Prevention was not even conceived until about 1950 or so. You may recall that during World War II, they gave out cigarettes to all the troops, so that if you weren't a smoker when you went in the Army, millions of men came out as smokers. And it wasn't long after that that physicians began to see an epidemic of heart attacks and related problems. So scientists wanted to find out what the cause of that was. And they began to look around the world at other countries to find out whether the risk of heart attacks was the same throughout the world. And they found out there were striking differences. And it seemed to be due to what people ate. For example, in Western countries like the United States or Scandinavian countries like Sweden, we have diets that are high in saturated fats, that are animal fats, red meats, dairy products, butter, cheese, milk, eggs, ice cream. And wherever a country had a diet like that, they had a high risk of heart attacks. In addition, if you look at countries that had low risk of heart attacks, you will find just the opposite. For example, Japan. In that country, they eat a lot of, at least they used to eat a lot of vegetables and fish, and they had low heart attack risk. And there were other places too. For example, the Inuit Eskimos ate mostly a fish diet. And there were parts of Africa where they ate mostly vegetables. And heart attacks are unheard of in those places. And you can correlate this with the blood cholesterol level. So in countries where the blood cholesterol level is about 150, there are no heart attacks to speak of. But in countries like the United States, where the average cholesterol level is 240, heart attacks are significant. If you look at the history of the Japanese, it's pretty instructional. The Japanese living in Japan have a low risk of heart attacks. As soon as they move to Hawaii, the risk of heart attacks starts going up. And it seems to be due to the fact that they changed their diet when they move. And then the Japanese that came to California to live and adopted American ways of eating, the risk of heart attacks became the same. So there was a clear correlation between what you ate and the risk of heart trouble. So scientists decided to see if they could prove the connection. It wasn't enough just to say that it seemed to be the case. So they went into the laboratory and they did experiments on dogs and other animals, and they determined that when they fed them high-fat, high cholesterol diets, they would develop clogging of their arteries too. It was more difficult to try to prove that you could change a person's risk by changing their diet. Those kind of studies are very difficult, and to this day, there is no excellent large-scale trial which proves that if you go on a so-called heart-healthy diet, low in fat, that you'll have less heart attacks. But there's a very strong belief based upon a lot of information and a lot of studies that this is probably the case. And that is why the National Institutes of Health recommends a low-fat diet, low in cholesterol, for people who want to prevent heart trouble. There were trials that tried to prove that if you went on a low-fat diet, you'll have a lower risk of heart attacks. And the reason why those trials didn't work out very well, if there was any improvement, it was minimal, is because when you go on a low-fat diet, even if you're really strict about it, and you reduce your intake of cholesterol, you can only reduce your blood cholesterol level by about 10 or 20%. In other words, the amount of lowering of the fats in your blood that you can achieve with just diet is not enough to affect your prognosis. And so that left us sort of stuck. And in the 1970s, people began trying to reduce fat in their diet. They thought it was reasonable to cut down on red meats and dairy products. They would bring 2% or 1% milk into the home. They wouldn't take their kids to McDonald's very often. And so there was a real effort around America to do this, although it wasn't clear that it was doing any good. But in the 1990s, something extraordinary happened. The statin cholesterol-lowering drugs were invented. And that changed the name of the game, because when you did large-scale trials with thousands of people, and you put them on these drugs and lowered their cholesterol numbers significantly, and I mean a major drop, not the small amount you get from what you eat, then it was proven for sure that there'd be less risk of cardiac problems in those patients. I have to explain something to you about prevention. There are two kinds of prevention. There's primary prevention and secondary prevention. Secondary prevention means that you already have heart trouble, and you want to prevent any more heart attacks or any more problems or progression to occur. And that was the group where the benefit was the greatest with statin drugs. And clearly, anybody with coronary artery disease now should be treated with these cholesterol-lowering drugs. But the more interesting story is whether or not you should treat people. You should treat people with drugs who do not have heart trouble. One thing you have to understand is that a person can be walking around and have heart trouble and not know it. It's called silent heart disease. So if physicians could identify people who seem to be healthy, who would benefit from cholesterol-lowering drugs, that would be ideal. And that, in fact, has been shown through research trials that you can, in apparently healthy people, improve their prognosis. So how do you decide? Should you put everybody in the country on statin drugs? Sometimes cardiologists joke about that we want to put it in the water. But obviously you can't do that. So what you do is you look at a person's risk profile. Heart trouble is not just due to fats in your diet. There are other factors too. They're called coronary risk factors. And what you need to do if you want to really help a person is address all of the risk factors. So that includes cigarette smoking, and everybody knows that, and the amount of smoking in this country has declined dramatically in recent years, but also high blood pressure. High blood pressure is called the silent killer. And if people don't have their pressures checked and they're high, they're at risk for a heart attack and a stroke. So it's important that blood pressures be checked, and if your pressure is too high, if you have hypertension, you have to go on treatment. When I first went into medicine, we didn't have very many good drugs for that, but now we got great medications for normalizing blood pressure. And then we have the problem of obesity, and that's another huge issue in this country. So these various risk factors, and there are others, but those are some of the major ones that doctors need to address. They have to do multiple risk factor assessment on their patients. Now, I want to just say something about nutrition and diet. It turns out that a low-fat diet may not be the best approach to preventing heart disease. It sounds obvious, like it should be, and it really is true that people should avoid saturated fats. But the thing that's been missing, and saturated fats are animal fats, as I mentioned before. But the thing that's really interesting about the most recent advance in the field of prevention is that we have good fats and bad fats. The bad fats are the saturated fats, and they should be reduced. But the good fats, they're another story. They actually protect your arteries, and we didn't know that until recent years. So what do I mean good fats? I'm talking about any fats of vegetable origin, particularly olive oil, canola oil, safflower oil, corn oil. There are some wonderful margarines you can get in the store, such as Heart Balance, where they have a mixture of these so-called good oils. And what we've learned is you don't have to restrict your intake of those oils. Now, you might want to limit your intake of good oils to some extent because fats are fattening and it can cause you to gain weight. But in general, cut out the saturated fats and don't be afraid to eat the good fats. If you have to pick a diet to prevent heart disease, go on a Mediterranean diet. Like, make believe you're a Sicilian fisherman or you live in Greece or southern France. And what they eat is they eat a lot of fish, they eat vegetables, fresh fruits, they drink red wine, they eat whole grains, and they are also farmers and they exercise, many of them, all day long. So exercise all day long and watch what you eat and lose some weight, and you're going to be have a better prognosis otherwise. And the bottom line is that you can prevent heart disease. And don't forget, my book, co-authored with Eileen Goldfinger, Preventing Heart Disease. It's called Prevention Does Work, A Guide to a Healthy Heart. And in it, we have covered all the things your doctor doesn't tell you, such as about prevention and how to prepare heart-healthy meals. Thank you very much. It's been a pleasure talking to all of you. You're a good-looking audience.